Hey everybody, I wanted to take you through one of the circuits that I came up with for one of my shoulder pain patients. So a lot of people have shoulder pain either from a tear or from a sports injury or something like that, or just wear and tear, just old age, for example. Whenever I put together circuits, it's a series of exercises that are all linked together. And so it's a very efficient way to train, and everything kind of flows from one movement to the next. And so a lot of times with exercise programs, you'll do a certain exercise, you'll do 3 sets of 10, and in between you'll just wait. And too much waiting around. So from movement to movement to movement, everything is related, but it also allows, when you work one muscle, you allow that to rest, you go to a complementary muscle, and one by one you begin to warm up the entire area, and it's a really efficient way to train. So for this series, you'll need a foam roller, and you'll need either 1 or 2 bands. I think this is a 1/4 inch and a 1/2 inch band, okay? So whenever I start with any exercise or any training session, I always start warming up the spine in the center line first, because your spine and brain feeds into everything. So whether it's your upper spine or your lower spine or the front or the back, I always start an exercise and begin to warm up the body from the inside out. So the first one you will do is on a foam roller. So initially just lean yourself and put some weight into the foam roller, and then you'll lift your hips off the ground and just get heavy on the foam roller and just let your body relax. And so with the weight, you're pulling from your toes, just let your body roll over the foam roller. Don't slide, it's rolling, all right? And so you can go just with this one to the middle of your back. There's really no set number of how many times you need to roll it, but it's, again, like dough, you're trying to warm the tissues up. And every time you roll over it, you're bringing blood flow to the area, okay? So just a few times, like 20 seconds, just like that, okay? So from there, we just warmed up the upper back. And so from there, you can sit like this, you can stand, okay, or like this. So the next movement is just band pull apart. So you'll take the band, okay, try to squeeze your shoulder blades together, and you're pulling this straight across your chest, all right? So let's do 10. So there's 1, 2, arms are straight. Try to keep your spine straight. 3, 4, 5, 6, 7, 8, 9, and 10, okay? And then from there, so same movement, but now the palm is up, okay? Keep your spine straight, pull across, 2, try to get long. Get your arms as long as they can. Squeeze your shoulder blades together. 3, 4, 5, and you don't have to bring your hands all the way together. Keep the tension in the cord. I want your muscle to be like this rubber band. 8, 9, and 10. I lost count, okay? But so you have foam roller, band pull apart, palm down, and then palm up, okay? And then the next exercise, you're just gonna go into a push-up hold. So hold yourself in a push-up position, and this is the exercise. You're gonna take 5 breaths, 5 in through the nose, 5 out through the mouth, while you have this tension in the push-up position. So behind your tight abdomen, try to fill your belly with air. 1, 2, 3, 4, and 5. Good, okay? So a lot of times with shoulder pain, if I were just to have you do a push-up, that's very painful. So you don't want to do a painful movement, but we're kind of going around the pain. So this patient that I had anterior shoulder pain, so we're kind of going around the area, but we're not neglecting it, okay? So we did the strengthening, the massage, as well as the stabilization, okay? And now this next part of the series is more of a dynamic type stretch, dynamic stretching. So it's called thread the needle. So you'll take your, have your back flat, have a good base, So you'll take your arm, this is called thread the needle. You'll reach through, okay? Try to put your shoulder to the ground. Watch your hand as you reach through, and then you'll reach up to the ceiling, okay? Try to twist your body. So you reach through, open up. Don't fling this open. Try to go all the way to the fingertips. You can see that. Try to reach, get long. Reach through, 4 and 5. And then the other side. You scooch back so you can see. So you'll reach through, open up, feel where you're restricted. What's stopping you from getting all the way up here? And keep trying to rotate, pull your tissues up, get long. 3, 4, and 5. Okay, good. So you can go through that again. 2 to 3 times you'll go through the circuit. So this is part of our warm-up and our prep. So back to the initial. Catch your breath just from moving around. This is the massage, active rest. And so you're going along the spine, the 2 muscles that run along your spine, sacrospinalis, your paraspinals, often they're called. And so with this, you can also roll yourself a little bit to the side and begin to put different pressure on different areas of your back. So look for the tender spots, and those are the ones you'll want to roll over, okay? So the next one, band pull apart. I'll use the thicker band on this one, okay? So you can sit however you want. 10 reps, stay tall. 4, 5, 6, 7, 8, 9, and 10. Palm up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay? And you'll come back into the push-up hold. Breathe the whole time. So you have 5 breaths. You're stabilizing. Make sure your shoulder is over your hand, okay? Don't get out of alignment here. Crawl yourself up and have a good structure over your base. So you have 5 breaths here. So stabilize, try to relax. Don't let tension settle into your body. So breathe. 1. Head up. Stabilize. 3, 4, and 5, okay? And then just you can relax and shake that out. And then the last one in the series is just another thread the needle. So 10 times you'll reach through, you'll open up. 1, 2, 3, 4, 5, 1, 2, 3, 4. I'll show you from here. Try to get the 2 arms lined up top, okay? And that's it, okay? So that's the first initial prep circuit for some shoulder rehab that you can use. If you have, whether it's in the back or the front, this is a really good way just to warm up the tissues. And understand, we're going through these ranges of motion, but understand that the shoulders rotate in a circular pattern. Same thing at the elbow. You have a circular pattern at the elbow as well as a figure 8. And so we just strengthen the muscles, but taking the shoulder and elbow through these ranges of motion also help to promote fluid circulation to the joint. So I'm just taking the elbow and drawing a circle. Circles and figure 8s. Exaggerate it. Check your range of motion. This is a really safe exercise, but it helps to promote blood circulation to the joint, all right? And so all the muscles in the shoulder, okay,